Patient stories are extremely powerful, but it is a challenge to get a patient to agree to one. And even when a patient does say yes, there's a lot of work that marketers need to put in to make sure the experience is smooth and the output is what the patient is comfortable with. Joining me on the program today is Marnie Hayutin, the CEO and founder of Writing.Health. She is going to share advice on how to get and produce patient stories. Let's get to it.
Sway Health.
Well, Marnie, welcome back to the program. It is always a pleasure to have you here.
Thank you. It is great to be here.
Now, Marnie, before we get started and into the topic du jour, which is patient stories and how to get them and where to use them, can you tell our audience a little bit about yourself and your organization?
Oh, thank you. Yes, I am founder of Writing.Health, and we are a content agency. We work with healthcare companies on all aspects of their content, from strategy to execution. We do everything from case studies, web content, messaging framework, white papers, you name it.
Marnie, let's dive right in. You and I both know that some of the most powerful stories we can capture as marketers are patient stories, right? But they are very, very difficult to get. At least for marketing purposes, right? I mean, anecdotally, we hear patient stories all the time, but we getting them in writing or on video, very tough. What are the steps that you recommend people go through to actually try and secure a patient story that you can use for marketing purposes?
Yeah, that's a great question. So patient stories are very different from the typical writing that we do for marketing. They involve stories of maybe trauma, illness. They're very emotional. So we want to make sure that we're addressing them and conducting these interviews with compassion. And so we want to be very sensitive. So the very first thing in getting the story is to make sure that the patient is really ready to tell the story. Psychiatrists tell me that when patients are ready to share, the process of sharing the story really becomes part of the healing process, but not if they're not ready. So even though we have our marketing calendars and we know that this story fits in with our campaign that's coming up, we really want to make sure that we're not telling a story before the patient is ready to tell that story with us.
How do you even approach a patient to tell their story? Do you have any recommendations there?
Yeah, it's really important that we're very, very clear about what the use is. This work, the tips and things that I'm sharing today, this came from my work as a journalist, and it was from a piece and some research that I did for Writer's Digest about how a journalist can approach people as they are covering stories at the scene of a natural disaster or a trauma. And so the most important thing is to make sure that they really understand how you're using it. A lot of times they may think that you are from the doctor's office. They may think that you're telling a story that's only going to patients. So you've got to make sure that you're really honest about how the story is being used. They may still agree to it, and often they will, but you want to make sure that they have control over it. So the second part is to assure them that they have a way to stop the interview at any time, perhaps a hand signal, something that allows them to be in control of the process. And if they change their mind midstream, they can stop. They almost never do stop. It's just that idea of having control makes everybody feel more comfortable.
So what tips do you have as a former journalist? What tips do you have for the interviewer specifically to prepare for the interview with a patient?
So there are some really important techniques about how to do the interview that make it go more smoothly. In particular, when you know you're talking about an emotional story and you need sensitivity, start with the facts. So don't start with the how do you feel part. Start with, tell me, when did you receive your diagnosis? Or what was the first thing that happened? Start with the facts and wade in carefully. And then from there, we want to make sure that we ask really open-ended questions that aren't leading them in a direction. So we accidentally lead the interview subject in a direction by saying things like, oh, it must be really hard to get through the day, or I'm sure you feel terrible about this. What we want to be really careful to do is just be really neutral. Tell me more about this.
Marnie, thank you for sharing that great advice on what to do sort of ahead of the interview and during the interview. Let's talk about after the interview now. What advice do you have after you've captured the story?
So after you capture the story, it's marketing. So we know that everybody gets to approve this, and that's something that helps a lot, as opposed to journalism with marketing. Everybody gets to approve it. But the thing that you want to be especially careful of with patient stories is to make sure that you get everything right. So we can actually, by getting details wrong, we can inadvertently sort of re-traumatize somebody. Psychiatrists tell me that that can be the case. So we want to guard the details and be even more accurate than we always try to be. Um, Additionally, if we've promised to leave something out, if we have promised that we're going to keep something confidential, we have to ensure that we have followed that strictly and that they don't see something in a draft that you had promised not to use.
I like that. Especially, but I didn't think about sort of re-traumatizing the person. And that could go equally for a clinician or someone else who may have gone through something difficult, and that's might be why you're interviewing them. The loss of a patient or something like that. And if you get the facts wrong, yeah, it's like they have to relive it and they have to correct you. And
And
plus, it won't help your reputation, right? If you get something wrong in the interviews, so that is fantastic.
carelessness makes them feel like you haven't really been tuned in, like you don't care about this as much as they do. So it communicates something entirely different that you don't want to be communicating.
Right. Yeah. Like the fact that you didn't really listen and internalize it. And even worse is if it was on film, like how could you get that wrong? It was on film.
Yeah.
Marnie, is there anything you would definitely recommend people avoid as the writer or the interviewer when it comes to doing a patient story?
There really is something very important. As marketers, we're naturally empathetic. We've been in healthcare a long time, many of us, so we've experienced this ourselves or with other people. But in the context of telling a patient story, it's critical that we don't share our own personal experiences during this time. This is the moment for the patient to share their story. I've heard communications trainers talk about this as me too plus one. And it actually kind of diminishes the patient's moment. You know, they've done a lot of emotional work to come to you today to tell the story. We don't want to diminish it by talking about other people's experiences or in any way undermining it by talking about yourself or experiences of your friends or relatives or any others that you've talked with. So give them their moment, stay to the side, and let them tell their story.
Sort of classic journalism 101, right? Don't insert
Yes.
yourself into the story.
Yes, the story is not about you. So
Got it. And this is sort of a question I've always been interested in. Is there an expiry date on patient stories? Like, is there a time when, hey, if this story is older than X years, X months, you really shouldn't use it. It's got to be retired.
that is an excellent question. I think the rules are just a little bit different with patient stories. I think, as with all of our content, we're always looking to see what is it that the reader is going to take away. As long as there's still something relevant that the reader could take away, I think the story is still valid. Of course, unless it's talking about a treatment that isn't being used anymore or a technique that a technology that's not in use anymore, perhaps it's not relevant. But a personal story, I think, always is, as long as there's still a lesson that somebody else can take away from it.
Marnie, where is the best place to use patient stories? Like, website, anything like that? Like, where do you recommend people use these things after they've been produced and ready for publication?
I think they can be used anywhere where other patients or other doctors or will find them valuable. So I think video testimonials are great on a website. Written stories are really good as a download where somebody can really take some time to read it and think about it. But I think they're useful everywhere that the patient agrees to let it be used. So that's the key thing, is to make sure that the patient knows where you're using it. They Some may be sensitive to using it on social media. Perhaps it's not something you get to share on social media. So as long as the patient agrees, it can be used anywhere and everywhere. And I think real stories are always so helpful throughout the entire marketing process.
And I think one of the ways I've heard
over the years that isn't sort of outwardly facing, of course, is internally, right? You can use patient stories that you capture as part of your annual meetings or your monthly get-togethers as a clinician group or even as administrators. Just retelling a story that maybe someone has captured internally is valuable, right? It doesn't always have to be on the public-facing side of your website or your social. Of course, if that is the type of story you captured, then by all means, and you have, as you said, have agreement from the patient that that is how you're going to use it. But I think sometimes we forget that there's an internal side or internal use case for some of these patient stories too, where hey, it's just a great story, and we wanted to tell it so that the new batch of nurses coming in, the new batch of doctors, the residents coming in, get to hear the story about how the organization helped this patient or how they received outstanding care because the doctor spent a few extra minutes in the exam room or whatever it was. Those are powerful stories too that can be used just for internal purposes.
And definitely there's some wonderful work being done in the sway community where people are working hard to bring the patient voice into the process of developing technology, into the process of our solutions. And that work is incredibly valuable.
Marnie, you shared a lot of great information with us today. Where can people go to connect with you and with Writing.Health?
Oh, thank you so much. You can find us on the website, which is also Writing.Health.
Awesome. Well, Marnie, thank you so much for being on the program. Always a pleasure to chat with you, and we'll catch you on the next one.
Thank you. Thanks for the great discussion.
I want to thank Marnie for coming on the program today. I really appreciated the advice she shared. My key takeaway was how transparent you must be with patients. You have to be clear on how you intend to use their story, where it will be published, who will see it, and what they can expect through the entire production process. And hey, if you enjoyed this interview, please help us to continue producing these by mashing that like button and subscribing to this channel. Also, head on over to Sway Health, that's Sway with two A's, .health, where you will find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.